So with regards to vicarious trauma and how we kind of define it, and who actually experiences vicarious trauma, they're kind of interrelated. So with regards to vicarious trauma is essentially when someone who is in a caregiver relationship with another person who's gone through a trauma, they actually experience in many ways the residual trauma themselves. And so it's vicarious in the sense that you're kind of vicariously getting traumatized based on what? This relationship. Now, the relationship is a very powerful relationship because when you, as a caregiver, engage with a client or patient, you become kind of their empathic link, essentially. And through empathy, it's a very powerful emotion. It really is. But it also can what? It can get eroded over time when the trauma is too much to digest. So that is something that we have to think about. And what we see is with trauma is that when you have to digest this emotion over and over and over again, it does impact you psychologically, emotionally, and spiritually. And so what are some of the subtle signs that you might see? Well, the subtle signs that you might see are, for example, confusion, helplessness, resentment, irritability. Most people that are most susceptible to vicarious trauma are helping professionals. They are nurses and doctors and firefighters and paramedics and pastors and therapists like myself. And because we are in a position, a very privileged position, to sit with people in their most vulnerable moments, but that also in some ways impacts our own vulnerability if we don't actually take care of ourselves. So vicarious trauma is in many ways, it's insidious. You sometimes don't even know that it's happening because you feel different, but you're not sure why you feel different. And you also in a certain way feel like the work that you do, you're not doing a good job at it anymore. So it really makes you question your competency and if you're even really a good fit for the entire career that you've dedicated yourselves to. So it can be a very difficult professional moment for a lot of individuals in these different capacities. And I just wanted to add one other thing is that now with COVID-19, there are so many people that are experiencing vicarious trauma that we don't necessarily put in that box, which is teachers, educators of small children, preschool teachers, people that work in the grocery store, people that work in any sort of restaurant business. They are actually experiencing vicarious trauma as well, because they also have to care for people in a very different way, but they're still caring for people. They're still meeting their needs and providing services. And so we've never actually seen this in this way before. So it's quite unique.